So in today's topic, it's diet in cardiovascular diseases, chapter 16 in your dietetics textbook, page number 320. Those who have the new textbook, please mention the page number in the chat box. It's page number 322 in new textbook. If anyone is joining late, please help them out with the page numbers or the topic name. So cardiovascular diseases, its prevalence, okay. Cardiovascular diseases and coronary heart diseases, okay. These are two different terms that you have to understand. Cardiovascular diseases means all the heart and blood vessel related diseases. Cardiovascular, all the heart diseases, including the blood vessel related diseases. Okay, they all come under the category of cardiovascular diseases. Okay, coronary heart disease means what? There is a specific blood vessel that provides blood supply to the heart. This blood vessel is coronary artery. Coronary artery. It's an artery that provides blood supply to the heart. Okay, heart pumps blood to every part of the organ. Okay, heart is the pumping organ, but heart also requires blood supply to stay alive. Okay, so this blood supply comes from coronary artery. So any blockages, any disturbances in this specific artery is called coronary heart disease. Okay, so coronary heart disease is also a type of cardiovascular diseases. Okay, it's also a subtype of cardiovascular diseases, but it only affects coronary arteries. Okay, cardiovascular, by the way, the name suggests that cardiovascular, heart as well as blood vessel diseases. Okay, like angina, that is chest pain, angina pectoris, myocardial infarction, that is heart attack. Okay, heart failure, cardiac arrhythmias. Okay, heartbeats are not normal. Okay, heart valve problems, that could be genetic. Children who are born with septal defects, valvular defects. Okay, we say that there is a hole in the heart. Okay, that in layman's language we use this term, there is a hole in the heart. Actually, it is either septal disease or valvular diseases. Okay, so it affects the heart as well as the blood vessel. Is the difference clear to all? And prevalence, it is the major cause of death worldwide, not just in India. Worldwide, cardiovascular diseases are the major cause of death because of non-communicable disease. Cardiovascular diseases don't spread from one person to another. Okay, so it's a non-communicable disease. It's a lifestyle disease majorly. It is a genetic disease as well, cardiovascular diseases. Okay, so it's a non-communicable disease, which is the leading cause of death in men and even in women. Okay, in many countries, especially the developed countries, cardiovascular diseases, on top of that, it's very predictable. You can predict it. Okay, this person will suffer from a cardiovascular disease. It is preventable. It is treatable. Okay, even it comes under these categories. You can predict it when it will happen. Okay, you can prevent it. It is you can treat it. Okay, that is treatment option for each and every cardiovascular disease. But still, it is still the leading cause of death. It's around 47% of death in developing countries and 27% of death in developed countries. Okay, among the people who are below 70 years of age, majorly it is cardiovascular diseases. So here you can see how a coronary artery disease starts. Okay, it's a coronary artery disease. This is the coronary artery, okay, which supplies blood to the heart. And a healthy coronary artery, no, without any blockages. A coronary artery which has blockage or a plaque or atherosclerosis has started. Okay, so There is very less area for the blood to flow because something is blocking the blood flow. Okay, and automatically this plaque can become bigger and bigger, and it can completely stop the blood flow. And the area of the heart, usually the left ventricle, which is supposed to receive the blood, it undergoes necrosis. Imagine a part of your heart where it is not getting any blood. Heart is a muscular organ. Okay, that muscle structure in that area which is deprived of blood flow and oxygen starts dying out. And what happens if a part of your heart starts dying out? You get heart attack, you undergo through heart failure. Okay, this is the prevalence. 45% of death related to cardiovascular diseases. Then it is cancer, then other non-communicable diseases, respiratory diseases, diabetes, digestive diseases. Okay, but majorly you can see a big chunk is of heart disease, and also under heart disease. This is IHD means ischemic heart disease. Ischemic heart disease. This is what I have said. When there is a blockage in the coronary artery, slowly the blockage becomes bigger and bigger. Blood flow becomes narrower and narrower. Finally, there is no blood that can pass through the artery. It is completely blocked. The area which is supposed to receive the blood flow starts undergoing necrosis. Okay, the tissues, the cells starts dying off because of oxygen deprivation that the blood is supposed to bring. That area undergoes ischemia. Ischemia means the cells are dying, okay, because of the absence of blood supply or oxygen. It becomes brown, black, and it completely dies off. Okay, so that is ischemic heart disease. Hypertension, that is high blood pressure. Stroke, and other cardiovascular diseases like cardiac arrhythmia, heart failure, etc. So understanding your cholesterol, when you give your blood for cholesterol results, okay, this is how the results can show up as. If your cholesterol levels are less than 200 mg per deciliter, you are in a normal category, okay? It's a desirable level. 200 to 239, borderline. You have to be very strict with your diet from this phase onwards, okay? 240 and above, it means high cholesterol levels, okay? You could be already a cardiac patient here, or you could be suffering from severe forms of hypertension, hypercholesteremia. That is what we call in this situation, where your cholesterol levels are more than 240 mg per deciliter, okay? In the table given in the textbook, it's slightly varying, okay? But it's like using a reference chart from different laboratories. Okay, you give your blood test to different laboratories, and the reference range that you get from different laboratories also different. Okay, so but majorly if it is less than 200 mg, you are still on the safer side. Okay. So total cholesterol should be less than 200. It should not cross 200. Okay. If it is 200 to 239, as mentioned earlier, there is a risk of cardiovascular diseases. And if it is 240 or higher, you're already in the category of heart diseases. Okay. And even under cholesterol, there are different types of cholesterol. Okay. LDL, HDL, triglycerides. Okay. You have test for that as well. Okay. LDL is kind of the bad cholesterol. Okay. Low density lipids. Okay. So low density, so they can accumulate over each other. Okay, if the density is less, they are lightweight, they can accumulate over each other, they can deposit it very easily. High density cholesterol, they cannot get deposited, they will be definitely pushed in the blood flow. They cannot be stuck in one area. Okay, so that is good cholesterol. LDL is good cholesterol. Okay, so sorry, HDL is good cholesterol. LDL, it should be less than 130, okay, mg per deciliter. 130 to 159 is borderline. 160 or higher is heart disease category. LDL, HDL should be 60 or higher. Okay. And if it is more than 60, it's good. If it is 50 to 59, it's average, borderline. If you have very less LDL, less than 50, it's bad. Okay. And triglyceride as well. Triglyceride also should be on the lower side. It should not cross. Okay, triglyceride can also lead to heart diseases if there is too much of triglycerides in your diet. Okay, less than 150. Okay, that is healthy. Keep your triglyceride levels and LDL levels less. Okay, 150 to 199, it's borderline. 200 and higher, just like cholesterol, total cholesterol, if it is 100 or higher, it is a heart disease category. Okay. Values in your textbook is slightly different, but you understand what is good cholesterol, bad cholesterol. Okay, which two different types of cholesterol should be less. Okay, which one should be higher. Now, causes of cardiovascular diseases. Okay, we have divided the causes into different categories. Certain things that you can change, that is genetic, or that cannot be changed. Okay, like that. There are categories of etiology. So, category 1, here the risk factors for which interventions have been proven to lower the cardiovascular risk. Okay, when if you take interventions here, you can lower your cardiovascular risk. So cigarette smoking, what do you think? Is there an association of cigarette smoking and cardiovascular diseases? There is, because chain smokers, they also suffer from hypertension. Hypertension, high blood pressure is very common among cigarette smokers. Okay. And also cigarette smoking causes a lot of free radicals in your body. And these free radicals can damage your blood vessels as well. Health of the blood vessels. If the health of the blood vessels are at risk, you can develop a cardiovascular diseases. So cigarette smoking, it enhances the endothelial damage, that is the inside of the blood vessels that get damaged. Okay. It increases your heart rate, smoking. It increases your blood pressure. Okay. It lowers the LDL cholesterol, HDL cholesterol, which is good. Okay. The more you smoke, the more good cholesterol you will lose. Okay. It increases the LDL. It can constrict your blood vessels. It will make your blood vessels become narrower and narrower. Okay. And it also leads to clot formation or thrombus formation, blood clots. Blood within the blood vessels should be moving. Okay. It should be in a liquid state. It should be moving. It should not form blood clots inside the circulation. Within the circulation, blood clots should not be formed. Otherwise, it is called thrombus. So thus quit this, even if you quit the smoking after any heart attack. Okay, first time heart attack happened, you quit smoking. Okay, after that the cardiovascular risk will reduce. If you quit smoking after your heart attack, okay, cardiovascular development of second chances of heart attack, it reduces. Okay. Then having a high saturated fat, high cholesterol diet, having too much of ghee, too much of jams, okay, hydrogenated fat like vanaspati, okay, and then coconut oil, too much of coconut oil, okay, that also considers it has high saturated fat is present in this food, okay, that leads to cholesterol issues. High saturated fat or high cholesterol diet, eating a lot of fried food, had a lot of sugary fried carbonated drinks and all is a part of your regular diet, then it leads to cholesterol issues. High LDL cholesterol in your blood test, okay, even though the total cholesterol is normal, even though the HDL is normal, triglyceride level is normal, but LDL levels are high. LDL levels are on the higher side. That alone could also lead to cardiovascular diseases. Okay. Remaining of the indices are normal, but still LDL is high. It means it is a cardiovascular risk. Hypertension, that is high blood pressure. If you control your high blood pressure, if you are able to gain control over the high blood pressure, you can reduce the risk of cardiovascular diseases. If you're a smoker, quit smoking. Any drug abuse or substance abuse is part of your habit, you have to quit that. That also lowers your blood pressure. Stress management has to be done. If your hypertension is because of any stress, stress management has to be done. Then thrombogenic factors, the final event of a myocardial infarction is usually development of an intracoronary thrombus. Okay. So high circulating fibrogen concentrations that also can increase the risk of cardiovascular risk. Okay. If you're using certain medications and you quit using it, for example, if you were prescribed aspirin, ecosprin aspirin, and you quit using it without doctor's permission, okay, that can lead to thrombus formation in your blood vessels. Okay. If you abruptly stop using blood thinners, if you're prescribed on blood thinners like aspirin, okay, and if you abruptly stop that without the doctor's permission, that could lead to clot formation in your blood vessels. And this clot can also go and deposit in certain thin blood vessels and stop the circulation there. Okay. Next is category 2. Here again, risk factors. If you take interventions, again, you can lower the risk of cardiovascular diseases. If you suffer from diabetes, okay, from a very young age or from the past 10 to 20 years, if you're suffering from diabetes, okay, patients with diabetes have threefold greater risk of developing cardiovascular diseases, okay, or coronary heart diseases. Once you get into the stage of diabetes, it takes away a specific protection that your body has against coronary heart diseases. Okay, especially for the female gender, especially for women who have uh, attained menopause, and after menopause, if a woman gets diabetes mellitus, her risk of developing cardiovascular diseases is 3 times than men. Okay. Women have to be very careful about their blood sugar level, especially after menopause, because there is no estrogen that can protect you. Estrogen is also a hormone that protects you against cardiovascular disease. And also people who have diabetes, they have some metabolic issues like insulin resistance, abnormal lipid profile of their blood, okay, hypertension, obesity. In India, diabetes is not that associated with obesity or overweight issues, okay? But in Western countries, diabetes is associated with obesity. That's why you find diabetes as well as cardiovascular diseases together. in an obese person. Okay. So that's how diabetes affects the risk of developing cardiovascular disease. Then physical inactivity, a sedentary lifestyle, okay, a low cardiorespiratory fitness, these all are associated with risk of developing cardiovascular diseases. People who have a sedentary lifestyle, their risk is high. And then your low HDL cholesterol, okay. If all the other parameters are normal, if you have low LDL, low triglyceride, okay, but your HDL is also low, okay, that can also point you towards a cardiovascular diseases. Okay, when you do your total cholesterol is low, okay, your LDL is low, triglyceride is low, but HDL, which is supposed to be high, okay, that is also low. That is also an indicator of a risk of developing cardiovascular diseases. Obesity, as mentioned earlier, the more adiposity, the more fat storages you have in your body, your risk of cardiovascular diseases and also other lifestyle related diseases are high. Okay, not just cardiovascular diseases, hypertension, sedentary lifestyle, glucose intolerance, okay, insulin resistance. These all are high, especially the abdominal fat. Even if you are slightly overweight, okay, even if you have a lean body, you are not overweight, but you carry a lot of abdominal fat. Okay, we carry a lot of abdominal fat. That is a sign of cardiovascular diseases. Okay, then postmenopausal status. Women after attaining their menopause, their risk increases because of the absence of estrogen. Then you have category 3. In category 3, the risk factors for which, again, interventions, if you take, it can lower the cardiovascular diseases, development of cardiovascular diseases. The psychological factors, depression, people who suffer from depression, social isolation, social anxiety, okay, any anxiety related diseases, all anxiety related disorders, okay, that also comes under psychological factors. When you are anxious, your blood pressure is high. When you are stressed, your blood pressure is high. So psychological factor also plays an important role. Even too much of stress can also lead to development of diabetes mellitus. Okay. Then elevated triglyceride levels. When the triglyceride levels, just even if the triglyceride levels are high, that is a sign of cardiovascular diseases. Often people who are obese who suffer from hypertension, diabetes, okay, their triglyceride levels are usually it is high. People who take a lot of alcohol suffer from alcoholism, their triglyceride levels are high. And then elevated lipoprotein. Too much of lipoprotein in your bloods. Okay, lipoprotein is supposed to move your move the fats in the blood circulation. Because of lipoprotein, the fat will not be deposited in one area. Lipoprotein will make sure that fat keeps moving. Okay, fat cannot move in your blood circulation as it is. It requires the help of a protein, that is lipoprotein. Okay, so too much of lipoprotein that you have, it is a sign that there is too much of lipids in your blood profile. There is too much of lipid in your blood profile, because of which the body is producing a lot of lipoprotein to get rid of this excess fat. Okay, so elevated lipoprotein can be a sign of cardiovascular disease. Elevated homocysteine. Homocysteine again is a protein that is supposed to break red blood cells. Okay, too much of homocysteine, a lot of red blood cells are getting broken down. Okay, so that is also a sign of cardiovascular diseases. Especially people who suffer from arthritis, any inflammation, okay, they are also having a high amount of homocysteine. Then oxidation, And antioxidants, when free radicals as a part of oxidation. Okay, oxidation means your cells are taking up oxygen, okay, giving out carbon dioxide and some free radicals as a process. Okay, so when oxidation takes place, anything, even if your LDL is oxidized, okay, that can also attract a lot of white blood cells in your stream, okay, bloodstream, and that they can attach to the place where a lot of LDL is there, and it can start forming a clot in that area. Okay, so that's how too much of oxidation can lead to LDL cholesterol causing a block in your blood vessels. Antioxidants, taking antioxidants can prevent it. Taking vitamin C supplementation is also helpful. Studies have not confirmed it, but taking vitamin C supplementation in coronary artery disease patients can be helpful. Okay. So antioxidants, not just vitamin C, anything that has flavonoids that is present in colored vegetables, okay, fruits, tea, wine. Vitamin E as an antioxidant is also important to decline the coronary heart disease rate. Beta carotene, okay. Patients who have low levels of beta carotene, a high chance of developing myocardial infarction, heart attack, especially in smokers. People who are chronic smokers, their beta carotene levels are low. Okay, and because of low beta carotene levels, the risk of heart diseases is more. And alcoholism, individuals who consume too much of alcohol, okay, it's not just moderate but too much of alcohol, they can also develop cardiovascular diseases. Any form of alcoholism, we will not suggest mild or moderate. Okay, staying away from alcohol is the best decision. Okay, no, there is no mild consumption, no moderate consumption. Okay, today the physicians will not say that 10 ml or 15 ml of alcohol on a daily basis is good. It's not like that. Okay, no alcohol is as good as a little bit of alcohol or in moderation. Okay. Category 4, again, risk factors that are not modifiable. Okay, you cannot change this. Age, you cannot change your age. Risk of developing heart diseases is at the peak when you are between your 50s and 55. When you crossed 50 years of age, anyone who has crossed 50 years of age, your risk is at the peak of developing a cardiovascular disease. You cannot change your age. Okay, you cannot stop this risk. Sex, men, they they have high risk of cardiovascular diseases, coronary heart disease especially. The death rate and the disease rate in men is high, but after menopause, the incidence of developing cardiovascular diseases increases in women. Okay, by the age of 70, men and women, the risk is same. Okay, there is no difference that men have higher risk or women have a higher risk. Up till the age of 50, 55, men had higher risk. Uh, 50 to 55 or 40 to 55 is also the age of menopause. After menopause, women have higher risk till the age of 70. But after attaining 70 years of age, men and women both have same risk of developing cardiovascular diseases. Family history. Early onset of cardiovascular diseases are seen in individuals who have a family history of cardiovascular diseases. Okay, or some families, they are naturally susceptible to high lipid profile. Okay, hyperlipidemia. So far what we know is around 30 genes are involved in this disease process. Okay, in many variations. So any gene mutation, up from this 30 gene, any gene mutation is present in any individual, that leads to risk of cardiovascular diseases. For example, if there is a history of heart attack before 55 in father and before 65 in mother, okay? Before 55, before the age 55, father got a heart attack. Before the age 65, mother got a heart attack, okay? The offsprings, the children these parents will have, they will have a higher risk of developing heart attack at an early age, maybe in 30s or 40s. Okay, so that is family history. So is the causes clear to all? The different causes of cardiovascular diseases categorically. After menopause, if you compare a woman at 45, she got her menopause, and a man at 45, okay? If it is a woman who has attained menopause, her risk is double of developing cardiovascular disease as compared to men of her same age, okay? Some women will get their menopause at the age of 55, okay? We can't be sure. It is also a family history of menopause. Some women attain early menopause, some women attain late menopause, okay? So whatever age a woman is attaining menopause, okay, and if you compare that woman in that particular age with men of that age, the woman's risk of developing cardiovascular disease is high, okay? Estrogen is the hormone that protects women from cardiovascular diseases till the age of menopause. So development of atherosclerosis, you can see here. So earlier it's a very thin lining of plaque that is forming in the artery, okay, very thin. It is just oil, okay, it is just lipids, LDL, low density lipids, okay. Over time, since this lipid is attached here, it will attract a lot of blood cells, monocytes and all, okay. These cells will come and attach itself to the plaque, okay. Slowly it will it will grow, and the lining of the artery where it is growing, this side where it is attached, okay, uh, wherever the plaque is attached, that lining undergoes damage one by one, okay. Sometimes what happens is that the plaque will have its own blood supply also, because a lot of blood cells have deposited here, okay. It starts behaving like a living cell. Sometimes the plaque will rupture, okay. The fat that it has collected, it will rupture. You can see here the plaque, how it ruptures. And these molecules, this can travel because this is lightweight, okay. The ruptured molecule is lightweight. It will travel through the blood circulation and get deposited somewhere else, and there it will start the plaque, okay. Or it can go and get deposited in your lungs, and it can give you it can get deposited in your heart, tiny vessels. It can give you a heart attack. If it goes and deposits into the lungs, you will be breathless, and within some moment the person can die, not able to breathe properly, okay. So that is the risk of the plaque rupturing, okay. The plaque can rupture, okay. It is, you can see here, it has increased in its size and mass, and sometimes it can rupture, okay. And wherever it is rupturing, your body identifies it as a part of the body. And what happens? The blood will come here wherever it has ruptured, and it will form a clot. Okay. Blood does not understand this as a separate entity. Blood will take this atherosclerosis plaque as its own entity, and it has understood something ruptured here. So immediately the blood has to form a blood clot. Otherwise, it thinks that the human being will die out of bleeding. Okay. So the blood will come here and form a blood clot. And you can see already it was a very narrow space through which the blood can flow. Now it has ruptured. The blood has come here to form blood clot. Now you can see how small tiny area is left for the blood to flow. Okay. It is negligible, or it is almost a 90% of block, 90-95% of block. Okay, high risk of developing cardiovascular disease or heart attack. Okay, is it clear how atherosclerosis is developed? So coming to the treatment, if you want to reduce your triglyceride level, reduce alcohol intake. Okay, taking too much of alcohol can aggravate your triglyceride levels. Focus on weight reduction, increase physical activity, reduce your carbohydrate and fat intake, and increase your omega-3 fatty acids. Your triglyceride levels should come down. Okay, we'll discuss that in detail. So in your textbook, they have given some paragraphs on what cholesterol is. Okay, can plant-based diet give you cholesterol? Can a plant-based diet give you cholesterol? No, you will not get cholesterol from a plant-based diet. You get cholesterol only from animal-based diet, including dairy products, ghee, butter, including that. Okay. There is no cholesterol in a plant-based diet. Cholesterol only comes from animal source. Okay. So about cholesterol, saturated fatty acids, trans fatty acids, triglycerides, they have given small paragraphs in the textbook. You can do your self-study, read it, okay, understand it. Coming to the treatment. So you have dietary management, drugs, exercise, smoking cessation, that is stopping smoking one by one. Okay, so, controlling your smoking and then completely quitting it. Stress management, these are all the different modalities of treating cardiovascular diseases. The drugs part, what medications are used, that we will not discuss. Okay, that is a clinical part. Dietary management, we will discuss in detail. Some part about exercise as well. Okay. So coming to the dietary management, you should have a low fat diet, low calorie diet. Calorie control has to be done because there are high chances that you're dealing with a person who is either overweight or obese. If you're dealing with cardiovascular diseases, there are high chance obesity is lurking around. Okay, obesity or overweight issues, weight gain issues are lurking around, or at least abdominal fat. Okay, that issue is predominantly present. Okay, so we have to focus on a low calorie diet. Okay, you have to control, you have to portion control has to be done. Calorie restriction has to be followed. Okay, low trans fat. Okay, which food do you think gives you trans fat? Any idea which food do you think gives you trans fat? Yes, all the bakery food, bakery items, highly processed food. You take a pack of Lay's chips, you read the ingredients, you will see what trans fat is. Okay, any packaged processed food, snacks and all. Okay, deep fried food, deep fried snacks, KFC, burgers, okay, pizzas, they all are high in trans fat. Okay, so you have to cut down all these types of food. Saturated, low in saturated fat. So coconut oil, butter, ghee, you have to cut down a bit. Okay. Yes, repeatedly heating of the oil, that also leads to too much of trans fat. There is no nutritional benefits of trans fat. Okay, like how omega-3 fatty acid or coconut oil or omega-6 fatty acids, fish oils. Okay, these all things are supposed to give you some nutritional benefits. Okay, even the palm kernel oils. Okay, the red palm oil. these are also supposed to give you some nutritional benefits. Trans fat has no nutritional benefits at all. It is just basic fat without any nutritional benefit. Okay, so avoid that. Low saturated fat, control your ghee consumption, avoid ghee. Okay, control your coconut oil consumption, control butters. So low saturated fat, low cholesterol. Animal non-vegetarian food you have to control. Okay, even if you're eating chicken, etc., try to have the boneless chicken. Okay, focus on boneless chicken, chicken breast, chicken thighs. Okay, so because that area of that part of the chicken is low in fat, it is basically just protein. Okay, red meat and all, avoid it. High polyunsaturated fatty acids. PUFA means polyunsaturated fatty acids. That is the full form of it. Okay, so this is like omega-3 fatty acids, omega-6 fatty acids in a specific ratio. That is polyunsaturated fatty acids. Olive oil is an example of it. All your vegetable oils, oils, vegetable seed oils, okay, majority of them come under polyunsaturated fatty acids. Sunflower oil, mustard seed oil, sesame seed oil, gingerly oil. Okay, these all are examples of polyunsaturated fatty acids because they have a specific combination ratio of omega-3 to omega-6 fatty acids. Different types of omega-3 and omega-6 fatty acids in a specific ratio they you find them. Okay, so that is found in polyunsaturated fatty acids. So use that. Vegetable oils, vegetable seed oils. Okay, these are the best examples of polyunsaturated fatty acids. Then low carb diet, reduce your carbohydrate intake because too much of carbohydrates, your body tends to store it as fat. That is also risky. Okay. Protein intake can be normal. Add more fiber to your diet. High fiber diet. Okay. So these are the dietary management. Basics of the dietary management. So when it comes to fats, omega-6 fatty acid, it is found in olive oil, wheat germ oil, grapeseed oil, pistachios, pista, sesame oil, hemp seed oil, pumpkin seed oil, chia seed oil, safflower oil, sunflower oil, cottonseed, raw nuts. Okay, these all are the oils that are rich in omega-6 fatty acids. Okay, and there is a ratio of omega-6 to omega-3. Okay, that ratio should be clear. Okay, we will discuss that ratio. So there is a there is a table in your textbook. Approximate fatty acid composition of dietary fats and oils, usually which is used in India. Okay. Table 16.2, I guess, page number 332. In new textbook, you can mention the page number. Approximate fatty acid composition. So from that table, which oil do you think has the highest saturated fatty acid? SFA they have written, which is saturated fatty acid. Which oil do you think has the highest saturated fatty acid? Yes, it is coconut oil. Okay. So the oils that have the highest saturated fatty acid have to be avoided. So coconut oil, palm kernel oil, butter and ghee. This has to be avoided. Okay. For a once in a while you can have. Once in a while is completely fine. But as much as possible on a daily basis, don't consume coconut oil, palm kernel oil, butter or ghee for a cardiovascular patient. Okay. So which oil do you think is best? Give 3 examples that are low in saturated fatty acids from the table. Which three oil can you suggest? Yes, mustard oil, canola oil, safflower oil, olive oil. So mustard, safflower, even sunflower oil you can use. Okay, sunflower oil is safe for heart health. Below 15 is the saturated fatty acid, then it is completely safe. Flaxseed oil, you can't use it for cooking, but you can sprinkle it at the end. It can give you some. Refined oils, you can go for first press oil, okay, unrefined one. You can go for kachi ghani oil, okay. Refined oil also can be used. There is no harm in that, but the amount of oil that you use in your cooking, that is what matters. The quantity of oil that you use is what matters. Omega-3 is rich in salmon, soybean, canola, mackerels, that is sardines, flaxseed, kidney beans, chia seeds, walnuts, spinach. So they all are rich in omega-3 fatty acid. So oleic acid content by the oil. Oleic acid is a type of, see, for per person per day, it depends on your gender. If you are a sedentary person, okay, don't consume more than 30 gram of fat. If it's a woman, don't consume more than 25 gram of fat. If man, don't consume more than 30 gram of fat. Okay. Depends upon your lifestyle. For a sedentary person, these are the indices that we follow. So oils that have oleic acid are very good for heart patients. Okay. Oleic acid is a specific type of essential fatty acid which can reduce the risk of cardiovascular diseases. Okay, that is the benefit of oleic acid. So olive oil has the highest oleic acid. Okay, so olive oil can be suggested. Then canola oil, okay, soybean oil, sunflower oil, okay. High oleic acid sunflower oil is a separate type of sunflower oil that can be suggested. Here in coconut oil, it has the lowest oleic acid content. Okay. It's a monounsaturated fatty acid. Oleic acid is a monounsaturated fatty acid. So whichever oil has highest oleic acid, these oils are suggested for cardiovascular patients. Okay, so you can note down these are the oils: olive oil, canola oil, soybean oil, high oleic acid sunflower oil. Okay, coconut oil has the lowest, so it has to be avoided. Then when you use any blended blended oils are also used these days. So factories produce blended oil. They blend two types of oil. Okay. At home also you can blend oil, but the shelf life would be questionable. Okay. When you bring a packaged oil that is blended, Okay. They do add certain preservatives, healthy preservatives, which is not harmful. Okay. Healthy dose of preservatives, which can prolong the shelf life of blended oils. Okay. But at home, if you are making blended oil, the batch that you make, don't make it for more than 1 week. Whatever blended oil batch you are making, make sure you finish it up within a week. Okay. So liters of oil, you should not blend it and keep it. If it may go bad, it's a waste of resources. Okay. So blended oils, either you get it from the market, or if you are making at home, make it in small batches that you can finish up within a week. Okay. In a 1 week of cooking, you can finish up. So when you're buying this blended oil, you have to look for the egg mark logo. This is the egg mark logo of Government of India. Okay, so it means this oil is genuine. It has been tested. Okay, it is safe for consumption. And also you can look for the FSSAI symbol. Okay, these two symbols, if it is present on the blended oil that you're buying from the market, it's safe to use. Okay, so make sure you check for the egg mark logo. So also there is a recommended combinations of blended oil in your textbook on page number 335. Okay, so Government of India has permitted mixing two edible vegetable oils and selling it. We call this as blended oil. Okay, because some oils may have very less amount of saturated fatty acids. Okay, or any monounsaturated fatty acids, oleic acid, omega-3. To correct that, if some other edible oil is mixed, it comes to a proper ratio, which is good for human consumption. Okay, because we are trying to correct the ratio of omega-6 and omega-3 fatty acid. We are trying to bring it to the normal ratio. Okay, so that is what the focus should be. So blended oil helps you to get these proportions correct of omega-3 and omega-6 fatty acids. Okay, and it is good for optimum health as well. So table 16.5, recommended combinations of oil. Recommended combinations of oil. You can mention the page number where this table is in your textbook. It's 337, I guess. Yeah, 337. So when we talk about ratio, what do you think? There is a ratio between the first example, let's say, groundnut oil and mustard oil. They have written GNO, MO. GNO stands for groundnut oil. MO stands for mustard oil. Okay. They have given the ratio 3:1. How do you think you will make this combination? How much groundnut oil? How much mustard oil? How many parts? GNO is to MO, groundnut oil and mustard oil. Put in the chat box, what do you understand by this ratio of 3:1? No, this is where it gets confusing. When we talk about ratio, okay, when we say 3:1, okay, you have to add 2 part of groundnut oil and 1 part of mustard. Okay, when you put 3:1 into a division status, okay, it's 1/3. 1/3 means out of 3 parts, 1 part is mustard oil. So how many part remains? How many part remains? 3 parts are that in total. Okay, if you put 3:1 into division, so it's 1 divided by 3. So out of 3 parts, total out of 3 parts, you only have 1 part for mustard. So what remains? Only 2 part remains. Okay. So that is how you have to correct the ratios. Is it clear to all? Don't get confused. So different oils they have given, different oils that we use in our Indian cooking: groundnut oil, soybean oil, sunflower oil, mustard, palmolin, sesame oil, safflower, rice bran, canola. Okay, these all oils in different ratios with each other. These all are vegetable oils. Okay, you will not find butter or ghee here. Only vegetable seed oils you will find here. Okay, so this is how you can make your own blended oil at home using the ratio. Make only small batch that you can keep for 1 week. Use it. Okay, this is for 1:1, one part each. If it is an international brand, look for FDA approved, okay, or ISO mark. ISO or FDA approved, you can watch, look out for that if there is an international brand that you are following. Okay. Then you have to focus on a low sodium diet. Very important when it comes to dietary modifications of cardiovascular diseases. Low sodium diet. So specific food that are naturally low in sodium. Okay, table 16.7, page number 337. Maybe in new textbook it is 339. Blending, just mix it together. Okay, just mixing it together. There is no other specific process. Okay, just mix it together and shake the bottle. That's it. In Indian brand, FSSAI mark, egg mark logo. These two logos you can look. The food safety logo, that is FSSAI, and egg mark logo. So low sodium food. In table 16.7, per every 100 gram, what is the sodium content of a food is given in the table. Okay, so the first column, that is the column that you can suggest for a cardiovascular patient or a hypertension patient. Okay, so what all are the vegetables or fruits or cereals that come under low sodium category? Bitter gourd, that is karela. Okay, bottle gourd, dudi, what we call brinjal, cabbage, colocasia, cowpea, cucumber, French beans, grapes, guava, that is amruk, honey, horse gram, okra or lady's finger, maida. Any oils are usually low on sodium. Onion, oranges, papaya, peas, plantain, the unripe banana, not the banana, but the unripe one. Potatoes, pumpkin, ragi, chiku, okay, semolina, that is rava, sugar, sweet potato, ripe tomatoes, vermicelli, okay, wheat, all forms of yams. Yam is suran, okay, watermelon, banana, broad beans, green gram, that is moong dal, lentils, mangoes, pineapple, radish, tomato, red dal, okay, masoor dal. Okay, these all are the food items that are that a person who has, yeah, loki or dudi, okay, that is bottle gourd. Maida also, see, there is nothing drastically wrong with maida as long as how you're controlling, you're not having maida on a daily basis. Okay, what is maida? Maida comes from wheat. Okay, if wheat is low sodium, maida is also going to be low sodium. Okay, if you don't have celiac disease, Maida is not going to cause you any harm. Okay, it is a high source of carbohydrates. Maida is a high source of carbohydrates. Okay, but the way how maida is used in cooking, okay, usually anything that has maida, if you check the recipe, what is the other macronutrient which is high in that recipe? Any guesses? Any food if you take in which you are using maida, okay, and try to imagine the recipe. Any dish in your mind, if you just pinpoint, what is the other macronutrient which is also quite high pairing up with maida? Yes, it is fat. Fat. Okay. Macronutrient. Fat. Different. Oil, cheese, butter, everything comes under fat. So maida alone is not a cause. Is alone not the demon here. Okay, it's not the villain here. What other macronutrient you are choosing? What other things you are choosing in the recipe? That also plays a major role. Okay, and usually if you take pizza, if you take Kerala parota, okay, the amount of fat that goes into that recipe, that is making that food unhealthy. It's not just maida. Maida is just refined wheat. Okay, it's just wheat flour that is refined. That's it. Okay, because it is refined, it has high amount of gluten. Okay, if you don't have celiac disease, you don't have to worry about maida. Maida alone will not cause you any harm until and unless you have celiac disease, which is just 1% of the world population has celiac disease or are allergic to gluten. That's it. Okay. So maida, when you hear about maida, you get scared because usually whatever recipes we are using maida for, it is deep fried. Okay, it is highly processed. Okay, a lot of oil also goes into that recipe. So that is why maida based recipes are usually we look down at it as a low healthy food. Okay, so that's about the low sodium diet. People who have hypertension and cardiovascular diseases, restriction of sodium has to be followed. 1.6 gram to 2.3 gram of sodium on a daily basis can be taken. And also keep in mind the sodium loss. If this person is active, they are sweating, okay, through their sweat, through urination, sodium loss also takes place. Okay, so if you are in a cold country, you can focus on a low sodium diet very easily. But if you are in a tropical country like India, where people usually sweat a lot, our climate is like that. Okay, especially if you are in a humid areas, coastal areas, okay, where you sweat a lot. Okay, so keep in mind of the sodium loss in sweat. Okay, you should not be extremely strict with salt restriction. You have to keep in mind the sweat loss. If you are in a cold country where you don't sweat much, okay, low sodium diet can be followed with proper restrictions. Okay, so far is it clear to all? Next, coming to functional foods for coronary heart diseases, cardiovascular diseases, functional food. This part is important from practical point of view. First is your vitamin E. Why I have put vitamin E, carotenoids, and vitamin C in green? All the green leafy vegetables, okay, they are rich in these three: vitamin E, carotenoids, and vitamin C. All your green, anything that is green in color, okay, green leafy vegetables or green vegetables, okay, that is green in color, dark green in color, are automatically high in vitamin E, carotenoids, vitamin C. Okay, vitamin E, you will also find it in vegetable oils, not in cholesterol based butter or ghee. Okay, Vegetable oils, vegetable seed oils, they are also rich in vitamin E. Dark green leafy vegetables, nuts, whole grain cereals. Okay. In AIMS, All India Medical Institute, they have done a study which showed that almonds decrease cholesterol concentration and improve the platelet function. This was a study done in AIMS, India. Okay. Almonds. Okay. Almonds are rich source of vitamin E because of the extra additional intake of vitamin E that went into the patient. Okay. It improved the cholesterol and it also improved the platelet function. Then carotenoids as well. All green leafy vegetables, along with that, yellow, orange colored vegetables, they all are good sources of carotenoids. Vitamin C, all citrus fruits. Okay, you all know which all fruits and vegetables are great in vitamin C. Amla is the best source of vitamin C. Next is guava, that is amruk. Okay, pomegranates, red grapes, pineapple, banana. Okay, these all are good sources of vitamin C. Coming to selenium. Next is selenium. All your uh, in non-vegetarian sources, kidney, liver, seafood are good sources of selenium. If you are a vegetarian, for a vegetarian diet, okay, you have you have parboiled rice, okay, or red rice, brown rice, okay, wheat, ragi. These are good sources of selenium for vegetarians. Since you can't have seafood, kidney, livers from animal products, okay, for selenium based food. And also in South Indian vegetarian diet, if you are used to white rice, this is white rice. This one in the center is the parboiled one, parboiled rice. Okay, this is the brown rice. Okay, so switch your white rice with parboiled one or brown rice. Okay, and add more ragi based food in your diet. Parboiled is like it is unpolished. Okay, it's you remove the bran. Okay, you see this bran in the brown rice. You remove the bran, you get parboiled. Okay, you polish it more, you refine it more, you get white rice. Okay, so these are the different stages. Yeah, mata rice comes under brown rice. Okay, mata rice, if you are using the red one, that comes under the brown rice with its bran. Okay, it's also parboiled. The other form of mata rice is parboiled. Jeera sar rice is white rice. Okay, jeera saru, that rice is white rice, or kaima rice, or jeera sar, what we call that is white. It is completely polished rice. So that's about selenium. Next is soya protein. Okay, anything that is a soya product, soya milk, soya bean, tofu, tempeh, okay, fermented soya beans, all these are great food options for people who have cardiovascular diseases. Okay, if you suffer from thyroid issues, if you suffer from hypothyroidism, you are diagnosed with hypothyroidism, only then avoid it. If not, you don't have to avoid soya products, because the benefits soya products can give you is far more than fearing for thyroid issues. Okay, so we cannot eliminate soya from the diet. Soya gives us way more benefits than its one disadvantage, that it is a goitrogen. Okay, so it can reduce your plasma cholesterol level. The isoflavonoids that it has, the antioxidants that soya products have, okay, that can reduce your cholesterol level. And the soya protein is a good protein as compared to other dairy protein, because it does not have cholesterol. Okay, fat content is very low in soya products, so it does not give you cholesterol. Okay, tempeh is kind of a fermented, you see this soya beans here. Okay, it's kind of a fermented soya product. Okay, that is tempeh. Then beans, any form of beans. Okay, they are naturally high in fiber, high in protein. High in fiber, high in protein. Okay, that also soluble fiber is present in them. Cap, magnesium, potassium, copper, folate, these vitamin B6. Okay, these all are present in beans. Okay, so more you consume legumes, your you will reduce the incidence of hypertension, high blood pressure. Especially pinto bean, this bean which I have shown, which is, it is a pinto bean, very good for diabetic patient and also people who suffer from cholesterol. This is a pinto bean which I have shown on the screen. Then all your fruits and vegetables, it's packed with antioxidants. The more variety of fruits and vegetables, the more healthy will your diet be. Okay, small cherry tomatoes. Okay, they are better than as compared to the large ripe ones. Small cherry tomatoes are better. Red onions are better than the white one. Okay, colorful vegetables. Colorful vegetables are good sources of antioxidants. Soya chunks are also good. Then garlic. It has been proven that garlic, some studies have been done, which proves that garlic can reduce your cholesterol level slightly. It will not cure cholesterol issues. It will not cure your heart disease. Remember that. But it can bring it down properly. Okay. Especially if you are in a borderline cholesterol area. If you are done your blood profile test. Okay, blood lipid profile has been done. If you are diagnosed with borderline, okay, you have to be careful. You can start having this garlic water. Okay, just smash garlic, 1 clove or 2 cloves of garlic, and pour hot water into it. Let it sit for 5-10 minutes for the hot water to become lukewarm or at room temperature. Then drink this water. Okay, early in the morning on empty stomach. Okay, so this garlic water can bring down the cholesterol levels. Modest reduction. It will not drastically reduce, but if you are drinking this garlic water and on a daily basis, if you are having fried food, okay, processed food, do you think garlic water will help? It will not help. Okay. An additional benefit, you can add methi also into it. Methi dana, methi seeds. Okay, smash some garlic, add some methi seeds, then pour boiling hot water into it, let it sit, close it, let it sit, let it cool down, and then drink the water. Okay, both can work very well in combination. Okay, so if your diet is completely out of whack and you are doing these garlic water, methi seed water, okay, it can be taken at any season. It doesn't matter. Okay, so with if your diet is out of whack and you're using this garlic water, methi seed water, it will not help. Okay, also to for hypertensive patient, people who have hypertension, add more garlic into your regular diet as well. Okay, then nuts and seeds, any form of nuts and seeds, especially almonds, walnuts, okay, peanuts. Okay, they are rich in unsaturated fatty acids, so eating a handful of them is good. Peanut, almonds, walnut, okay, these are good. Green tea, or milk, or any form of green tea has polyphenols, so that is good. That can prevent the oxidation that LDL causes in your blood vessel, damaging your blood vessel. That can be prevented. Green tea is better than black tea in terms of polyphenols. Okay. Fenugreek and oats, as I mentioned earlier, fenugreek, add more fenugreek into your diet. Have fenugreek water as well, along with garlic water. Have fenugreek water. Have more oats. Okay. Oats, ragi, add more millets in your diet. Okay. Yogurt and milk, calcium and casein. Casein is a protein found in milk. That have hypocholesteromic effect, that can reduce the cholesterol effect. Calcium rich food in general. Tips they have mentioned of adding fiber into diet. You can just read that tips later. Soaking nuts is not essential. Soaking legumes and soaking pulses is essential. You don't have to soak your nuts. Almond, walnut, whatever nuts you are using, you don't have to soak them. Eating them raw is as fine. Okay. Soaking helps with legumes. Soaking helps with pulses. Okay. Next, coming to DASH diet. DASH diet, it's basically a diet that has a lot of fruits and vegetables in their serving, and very moderate consumption of lean meat, red meat, poultry, fish. Okay, but a lot of vegetables, lot of antioxidant rich diet. That is what DASH diet is. Okay, for a whole day, it's given like this for a whole day. 8 to 6 servings of whole grains. Okay, legumes, nuts, seeds, 4 to 5 servings. Less than 6 servings of non-vegetarian food. Okay, less than 5 servings per week of any desserts, sweet. Okay, 2 to 3 servings of fats per day. That too vegetable oils, especially. Avoid cholesterol based fats. Low fat dairy should be used, or fat free dairy can be used. 4 to 5 servings of fruits, just fruits. 4 to 5 servings of vegetables. So the major servings throughout the day was fruits and vegetables. Okay. So that is DASH diet. DASH diet, the full form of that is dietary approach to stop hypertension. That is the full form of it. Dietary approaches to stop hypertension. So following this DASH diet has shown to slow the blood pressure and also prevent diseases like heart attack, stroke, diabetes, okay, some forms of cancer. It focuses more on eating fresh fruits and vegetables, okay, based on 2,000 calories per day. In India, for a regular sedentary person, even for a man, 2,000 calories could be high. Okay, 1,500 is still manageable. Okay, for women, under 1,200, and for men, under 1,500 is manageable, not to gain weight. Recent analysis of drinking wine, studies have shown that taking 1 glass of wine for women and 2 glasses of wine for men, drinking this moderate amount of wine is associated with health benefits. But recently, now the doctors say drinking no wine, no alcohol has much better impact on health as compared to drinking it, because the only thing that is good about wine is the antioxidants. You get the same antioxidants from other forms of food as well. If it is for antioxidants that you're drinking, okay, you have other many options, better options, okay, of antioxidants than to consume alcohol. Okay, so it boosts your heart health. fights diabetes, raises omega-3 fatty acid in your system, prevents breast cancer, prevents sunburn, boosts your brain health, reduces stress, prevents obesity, fights against anti-aging. These are the benefits, claimed benefits, but it's better to completely avoid that. The antioxidants that you get from wine, you can eat red grapes and get it in a better way. Next is Mediterranean diet. So Mediterranean diet is something that it will be very difficult for Indians to keep up because there are a lot of fruits and vegetables, but they are raw. They are in their raw form. Okay. And olive oil is the main source of oil that they use. Okay. They don't use butter or ghee, anything like that, only olive oil. And red wine is a part of their diet. Okay. It's a very healthy diet. It's a very one of the best diet known to mankind that promotes good health. But to put these factors, these principles into an Indian cuisine, it's near to impossible because vegetables, what they eat a lot of salads that are raw vegetables. Okay, and Indians like to cook their vegetables. Even if we have a predominantly plant-based diet, Indians have a predominantly plant-based diet, but it's cooked vegetables, not raw vegetables. Okay. So occasionally only they will have meat and sweets. Fish and seafood, it's done weekly. Dairy and poultry also it's weekly. But daily basis, they have a lot of fruits and vegetables, olive oil, red wine, bread, legumes, beans, nuts, seeds. Okay, and they engage in a lot of physical activity, eating with family. Okay, these are the principal guidelines of a Mediterranean diet, usually followed in Greece and all. Okay, it comes from Greece. So that's about diet in cardiovascular diseases. If you have any queries, you can mention in the